Tell us more about the research and intervention work happening at the CCDMP.
Yeah, so very broadly at the CCDMP, our research focuses on how does kindness develop, how does mental health unfold, and what are those underpinnings of kindness and mental health. So within that, we research, from the very beginning of development, from infancy up through, early childhood, middle childhood, adolescence, and beyond, how are different capacities related to kindness emerging, and what are the factors that promote that development. So in particular, we focus on what we call the 3 E's, so emotion regulation, as well as empathy, so different types of empathy, right? So empathy towards others, how you kind of feel with or relate to others around you, and then empathy towards the self, so how you, think about yourself and reflect upon yourself and how you treat yourself as an individual. So we look at, when do these factors emerge and what are the different elements in family interactions or community interactions, or, other environmental factors that impact that development. And so that's a lot of our empirical research going on. And then we also have been growingly working in practice-based research, right? So working with community partners to understand, what are the areas of strength in our community and where are there areas for growth or potential, and kind of working with them to develop different opportunities and different ways to apply our research to support the community.
Based on this research work, what advice do you have for caregivers and educators who want to promote social emotional development in their children?
I think a lot of caregivers and educators are already doing that amazing work of supporting healthy development in their children, right? So even those little everyday interactions, showing care on a day-to-day basis, giving a child a hug if they're upset, asking them to tell you about how they're feeling, or showing an interest in their interests, right? A lot of those very basic things are, setting the foundation for mental health and well-being. And also just recognizing there's going to be individual differences, right? Different children have different personalities that they're bringing to the table. So, tailoring that care approach to how a child is responding is also really helpful. And also, I think just having some grace with yourself as a caregiver and educator, molding the next generation is not easy work. So, just like children make mistakes, adults make mistakes, and sometimes that can be a really healthy learning opportunity for children to see you make a mistake. So I think in general, I would say just continue with what you're already doing, and treat yourself with kindness along the way.